to give you some information that I think is very, very important. Information that is really breaking in the world of mental health. And I just feel that the more people I can tell, the better it will be. And then we'll get on to, and then you'll understand why we need to upskill ourselves in the field of health and nutrition and how we can help not only ourselves, but maybe our family, our community, if that's what you want to do. So I want to show you what's happening in Australia, and then I'll show you worldwide, because this is based in Australia. I know my statistics pretty well in Australia, but they kind of are very similar to the US statistics, the English statistics, the South African statistics. I teach in Barcelona at the Barcelona College of Chiropractic at 5th year level, and their statistics are not as bad, but since the dietary guidelines came in 2012, I believe it was, you can see the change in the health of the Spanish, especially. You can actually see the chronic disease growing because they're following the dietary guidelines. The dietary guidelines being low fat, high carbohydrate, not worrying about what the food comes from, but rather the macronutrients, such as how much protein should I eat, how many carbohydrates should I have, how much of this should I have. So we don't necessarily teach that. We talk about it, but we don't teach that way. We teach very differently. So in Australia, 1 in 2 will have cancer. 1 in 5 has heart disease. 1 in 5 have a mental health issue. And that is in a 12-month period. But over a lifetime, it's 1 in 2 will have a mental health issue. And anxiety, depression, and bipolar are just 3 that I picked out, but there are more than those 3. Like, there's so many new in the mental health field, and we will be talking about that. So between the ages of 16 to 24, 1 in 2.5 have a mental health issue. So our young people are more likely to have a health issue, a mental health issue, than our older range group. 1 in 11 have diabetes that is diagnosed. They believe there's probably another 1.7 million people in Australia with pre-diabetes or diabetes that have not been diagnosed. 1 in 25 had an autoimmune disease. Back in the 80s, we didn't even learn about autoimmune diseases. Like, it was type 1 diabetes, and that wasn't even seen as a autoimmune disease. That was seen as a genetic disorder. So these autoimmune diseases have been building, and I think right now there's about 88 that they've named, where the body starts attacking itself. 1 in 25 Australians between 7 and 14 have autism. If we look at the overall statistics to an older age group, it's around 1 in 75. But between the ages of 7 to 14, we now have a rate of autism of 1 in 25. Something's happening. I was looking at the statistics of death statistics in Australia. And when I first started looking at them back in 2016, 2017, 2018, 2019, let's say, it was about 451 people a day died. That's around the 15 to 16,000 a year die in Australia, or all-cause mortality. I'm not, most will be chronic disease, but there will be some accidents and other things happening in there. So then I looked at the statistics in 2020, and that was the beginning of COVID, and that was about 170,000. So it had gone up about 4,000. Then I looked in 2021, 2022, and 2023. And the stats are in the 190,000 range that are passing away in Australia. I think I said 15,000 before. It was 150,000. I made that mistake. So what the difference is around the 15 to 20,000 more people are dying every year since about halfway through 2021. You got to ask why. Why is this happening? And when you have a look at the Australian current health statistics, you kind of go, there's something been happening since 1964. So in 1964, 4% of the entire Australian population had a chronic disease. We now have kids between 38 and 42% with chronic disease, and that's the age of 17. And with our adult population, by the time you reach 60, 80% of the population have a chronic disease. So this is some real issues happening here. So 1 in 4 children are obese or overweight, 2 in 3 adults are obese or overweight, and there's a thing called globesity now, and it is 12% predicted to be by 2030, 51%. So it's 12% at the moment. By 2030, it's predicted to be 51%. That means there are more people obese on the planet than there are starving. But this is what blew me away, was the World Health Organization's prediction for 2048. So by 2048, 86 to 90% of global deaths will be attributed to non-communicable diseases. That's not COVID, that's not measles, that's not mumps, that's not influenza. This is chronic disease. This is heart disease, diabetes, cancer, autoimmunity, mental health, to name a few. My question is this: why is the WHO not concentrating on these chronic diseases when communicable diseases will only account for 6% of the population, the death of the population, and 6% will be injuries? And if they're not going to do it, and the Australian government is not going to do it, and the US government is starting to do it, they're starting to look at the chronic disease and what is causing that chronic disease. But let's just say the Australian government is not going to do it, then, we're in trouble. I just have to tell you that the USDA, the US Dietary Guidelines, came out just recently, and it said there is no need for sugar between the ages of 0 and 12 months for a child. And yet, if you look at infant formulas, they all have added sugar in the way of maltodextrose, glucose. So they did a study, and there were 75 that they studied for the sugar amount in these infant formulas. And they found only 5 that did not have those extra added sugars. So we know that it can be done, yet 75 all had that extra added sugar. So I'm of the belief that we have to take health into our own hands. So if you're somebody looking for health, we can show you the way. If you're somebody who's looking for health for your family, we can show you the way. And if you're looking to help a community, we can do that too. So we're a grassroots movement, I guess you could say. We're on a ground level, that we're not trying to change government policy. I've done that. I've tried to change the tuck shop of my kids when they were going through school. And that was for 17 years. They were at the same school, and I never got to change that tuck shop. I have tried at a bigger level, but I realize now that what I have to do is educate people so that the groundswell can start. And there's an amazing groundswell. So I'm not waiting for the WHO to change things. I'm not waiting for the government to change things. What I'm trying to do is just create that tsunami of change. So this is what I've always said. If you don't want to be a statistic, don't do what everyone else is doing. Do something different. And the only way you're going to know to do something different is to educate yourself. So at the moment, if you're watching television or listening to radio, you're going to be listening to ultra-processed food ads, medication ads. What else do you listen to? I don't watch television anymore. I stopped it probably 5 years ago completely. I just decided that if something was important, somebody would tell me, and that I would listen to independent media. And my independent media is usually podcasts. I love to listen to people that can teach me something, as opposed to listening to ads and advertising. So if you follow the government guidelines, you will end up a statistic. If you follow the crowd, you will end up a statistic. So my thing has always been, I'm not following the crowd. I'm going to do something different so that I don't become a statistic. And that's in every way that I can possibly think of in my life. That's not just food. That's not just food and water and health and lifestyle, but it's also the way I parented, relationships, my office, I feel, is an amazing place to be. And I have one of my key team members here today. You'll see her as the Nutrition Academy, and I can't do without them. They're just the most incredible team. So I have a wonderful workspace and a wonderful team. So let's do things differently. I want to do mental health today because I feel that it is a growing concern, and there's some huge leaps of, I guess, research coming out that is turning the corner. So let's just look at conventional treatment for mental health. And by the way, you learn this throughout our programs, and you learn it through the philosophy of vitalism, and you learn it through the anthropological thinking anthropologically or evolutionary, as far as what did we eat, how did we live, what was our lifestyle, how much sunshine did we get, how much night sleep did we get, etc. So let's look at conventional treatment first. So your doctor will refer you usually to a specialist. The diagnosis, there is no blood taken. There's no urine tests usually. There's no fecal testing for the microbiome, nor are there x-rays or scans usually. Sometimes there can be scans, but usually there's no diagnosis through the medium of physical health. There's a book that is used worldwide called the DSM-5, and it's the symptomology to diagnose. So it goes through each disease, it tells the symptomology of, and then if those symptoms match what you've got, such as not enjoying life anymore and not enjoying activities anymore, or having periods of depression and periods of getting excited about things and then going back in depression and etc. These are the symptomologies. So this symptomology allows you to diagnose, or the doctor to diagnose. They view the brain as a bunch of neurotransmitters that can be manipulated with medications or drugs. The pharmaceuticals, which are the medications, more often are layered with multiple side effects. So if you have, let's say, bipolar, you'll be given quite a few medications to help you with your depression, but to also help you with your mania. Cognitive behavior therapy or talk therapy is part of that. And I was listening in to a podcast, and I will talk to you about the lady that I was listening to. And she basically said all of her psychiatry friends viewed mental illness as a chronic, mysterious, and incurable malady. That's quite sad that that's what these specialists are thinking. I don't know if all of them think that way. This was her cohort of people. So we have two fundamentals, and I'll now move on to what's a different way of looking at mental health. But our two fundamentals of what the two first modules are, what you learn in the Introduction to Nutrition, the Essentials to Nutrition, and the Functional Nutrition course, you will always learn these two fundamentals. And the first is vitalism, and the second is anthropology. So let me explain vitalism to you. Vitalism is not looking at a mental health issue, and I'll do it in mental health terms. Vitalism is not looking at a mental health issue as just the brain or the head. What I see between the head and the body is a huge neck. And in that neck, I see a spinal cord that goes to the brain. There are many nerves, facial nerves, especially the vagus nerve, which stands for wandering, and it wanders through all of your abdominal region and your digestive system, and it's sending feedback to the brain. So you have this huge neck between the brain and the body. And so vitalism is that if you do have a mental health issue, let's look at perhaps the whole body. Let's look at the environment around you. Let's look at the epigenetics and all of those other things that are not being looked at the moment in the conventional. So that's vitalism. Anthropology gives us a inkling of the lifestyle that was led, and now science has caught up so incredibly. I love it. So anthropology showed us that we saw the sunrise. We wore bare feet. Sometimes we wore probably leather, not rubber, but we wore leather. And we had this incredible flow of electrons through our feet. Anthropology told us that we lived outside and we were able to cope with extremes in temperature. So and anthropology told us what we ate and what places we ate these things. So, if you have extremes of temperature, then you might not have as many plants as whether you live on the equator. And we'll talk more about that. So it showed us food. It showed us the culture of food. How did we prepare it? What did we do in order to consume it? Did we ferment it or did we cook it? I'm creating a course at the moment on mental health and the ketogenic diet. And there's a wonderful it's a TED video. And it's about 2013 when it was done. And this TED video actually shows how we were cooktivores, as he calls us. And there's another book out called Catching Fire and you'll learn from Dr. Ranghan. He's an anthropologist. He believes fire made us human. It was us using fire to allow more nutrition out of the food that we were consuming that allowed us to then do more things with our hands and more things with our brain. It's fascinating, and you will learn that when you go through all of our courses. So they're the fundamentals. So with that lens, let's look at the new paradigm for psychiatry issues that we're now seeing today. So it's called Metabolic and Nutritional Psychiatry. And it's about looking at the whole body physically and mentally. And like I said, this is vitalism, where we look at everything. And there are 3 specifics that we look at. The first is brain metabolism. So when you eat a certain food, such as carbohydrates, then your brain runs on something called glucose. And that is a completely different change in metabolism of the brain. And I find this fascinating. So when you're eating these carbohydrates, it goes to one center of the brain. And what it does is it creates serotonin and dopamine. And what ends up happening is that you feel very calm and non-adventurous and happy to just sit and relax and not do too much. So carbohydrates come from plants. If we need to eat plants, we have to sit under the tree to eat it. We don't want to be adventurous. We don't want to have lots of energy. We actually want to sit under those plants, eat that food, that then what ends up happening is that we put weight on, and it allows us to survive when the plants aren't around. Whereas what we find when we eat a protein, we create a ketone body in the brain, which changes the metabolism of the brain, goes to another area of the brain that creates adventure and wanting to move and do things. And guess what? Animals which have protein and fats in them, they move. You have to be adventurous to catch those things in order to survive. So that's the brain metabolism. It either metabolizes on sugar or ketones, or it can go between the two. It can switch between the two. And there's a reason why, and there's an historical reason why, and now there's a scientific reason why this happens. And remember the dietary guidelines. They are based on high carbohydrate and low fat. And then they really want to push you to plant-based proteins as opposed to animal-based proteins. So there's a real push towards that. And maybe that's not exactly what the brain needs, depending on what is happening with you. The second specific they're looking at is circadian health. Dr. Ian Campbell out of Edinburgh University has been doing research on bipolar disorder, and he believes it's the changing of the brain metabolism using the ketogenic diet and the changing of light in your night and your day that changes the circadian health, which also changes those depressions versus manics with bipolar. And this circadian health is all based around the light that I'm sitting under right now, which is a blue light. I'll go out to my house and I'll have a red light to counteract that. And we dim our lights. I'm not dimming them right now, otherwise you wouldn't see me. But we will dim our lights at night just so we don't have that bright blue light. So that's your circadian health. And the third specific that they're looking at is the microbiome and how it produces the precursors to serotonin and dopamine and noradrenaline, and how important the microbiome health is. So the answer is the ketogenic diet and ancestral lifestyle. I just find now that they're breaking away from this conventional mode, the conventional treatment for mental health, which is only got to do with symptomology and using medications to manipulate the neurotransmitters in the brain. I love that we are now heading towards these three specifics of brain metabolism, circadian health, and microbiome. But guess what? It's not hard. This is not hard to change. It's actually easy. And anybody who does my course will know how to change this for anybody in their family, because they'll understand how to get somebody into ketosis and how to keep them in ketosis for as long as it takes for them to be well. Or it'll help them understand the importance of the microbiome and how we feed the microbiome. And we'll also teach you all of the quantum health that's out there at the moment with regards to light and sunshine and grounding and sleeping and night and day. It's incredible. So let's look at the history of the ketogenic diet. It was a survival diet for humans. If we had been under that plant and eaten all those fruits, very sweet, we would have put on weight. And then when the plant had no more food, we had to chase those animals. And when our carbohydrate rates went down, we would be eating the protein and the fat, or if we didn't have enough food, we would be using the fat stores in our body, creating ketones, giving the brain adventure, making you move so you could find food as opposed to eating the plants. I don't know about you guys, but I get excited by this. It also helped in extreme locations. So I want to talk about three tribes. And these three tribes, one, the Inuits, they live in Greenland. It's snow and ice. They eat seal and livers and anything that's available to them up there, they will consume. And when there's plant growth around, it's usually berries, and they'll eat berries in the summer. But if there's no plant growth because it's a cold season, then they will survive on that diet and they will produce ketones in order to survive. And if there's no food around, they'll use their blubber or their fat in order to produce ketones in order to survive until they've run out of fat stores. The Himbas, they live in the desert in Namibia in a hot region. And there's not a lot of food available to them, and they live on they live on dairy. They are herders as well as hunters. So they not only eat dairy of goat because they herd the goat, they still survive today, as do the Inuits. And I've been and visited them. Took me quite a few days to go into the deserts through a creek. I went for about 2 or 3 days until I found the Himbas that actually do not live off the bitumen, but live their old-fashioned lifestyle. So they do herd goats, but they also catch wildlife as well. So they're herders as well as hunters. And when plants are available, they'll eat plants. Now, this is a very fascinating tribe called the Yamana. And they don't exist anymore, but there's a book about them. There was a gentleman who went and lived with them, and he wrote a whole book on the Yamana. And they live in the very bottom of South America, where it's 5 degrees in the winter and 10 degrees in the summer. So it's always cold. They are fishermen, and they eat birds, and they use seal blubber on their skin, but they don't wear clothes. And they've never worn clothes. It's just not something that they did, but they were able to deal with the extremes in cold through the way their bodies, I guess, evolved to do. They're quite an incredible tribe. Then in 1920, there was, in the Mayo Clinic, there were seizures were happening in children. And they knew if the children fasted, the seizures would stop. So they figured out a diet that would mimic fasting, which ended up being the ketogenic diet, which was basically meat and dairy, which is exactly like the Yamana, the Himbas, and the Inuits. So they ate meat and dairy, and sometimes not dairy because dairy's got lactose in it. So they might just eat meat and some sort of carbohydrate, but not a lot. And that was helping kids with seizures, and that was the Mayo Clinic in the 1920s. Then medications came in, and basically they didn't need to diet anymore. These medications worked to stop the seizures, but there were some people where the seizures didn't stop no matter what medication they were given, and that was called retractive epilepsy or where the drugs just didn't work or the medication didn't work. So in 1930 till now, John Hopkins University Hospital had started with the help of two pediatricians and a registered dietitian called Millicent Kent. And Millicent Kent, for 40 years, helped many people with epilepsy, retractive epilepsy, to go on the ketogenic, stay on the ketogenic diet, and able to live at least seizure-free, or if not, vastly reduced. But when I went to university, I never learned about this. This was going on when I was going to university, yet I never learnt about it. And then in 1990, the Charlie Foundation started. And the Charlie Foundation started because there was a film producer whose son was having like 140 seizures a day. He had an operation. He was on 5, 6 medications. He was intellectually losing his brain power. He was really in a mess, this young boy. I think he was about 15, 16 months when it all started. And this film producer by the name of Jim Abrahams decided that there had to be a better way than what was happening in the hospital and what was happening with operations and medications. And he started to research, and he found Millicent Kent at John Hopkins. He took his son, his wife and he took his son to Millicent Kent at John Hopkins. They had to fast for 2 days, and that little boy, at the end of that 2-day fast, stopped all seizures. And then by the time Millicent Kent had finished with him 2 years, he was on the diet for 2 years strictly. He then stopped having any seizures or epilepsy or anything. It was incredible. So beautiful Jim Abrams, who, by the way, just passed away last November, started the Charlie Foundation. And from the Charlie Foundation, he started the Metabolic Summit in the USA. And that was about, I think they've done 6 or 7 years of that. And I learned a lot through the Metabolic Summit. And now we have psychiatrists starting nutritional psychiatry and metabolic psychiatry, which is Dr. Georgia Eadie is one, and she, because of her own health issues, she started doing it. And Dr. Ian Campbell, who I've already talked about, out of Edinburgh University. Georgia Eadie, quite an incredible psychiatrist, has written a really good book on this called, I think it's Change Your Diet, Change Your Mind. Something like that. And if you go on Spotify, you can get it. If you subscribe to Spotify, you can go to the audiobooks and you can get it for under the Spotify. It's a incredible book of her journey. And basically she's the beautiful psychiatrist that said psychiatrists view mental illness as a chronic, mysterious, and incurable malady, which is quite sad. So the ketogenic diet is not prescribing medications. It's merely getting the brain to use ketones, which then changes the microbiome, which then we start to change lifestyle as well with sunshine and things like that. And we're seeing some incredible results, which I love. So the ancestral lifestyle includes your sleep. When you go to sleep, when you wake up, it includes movement. We moved as hunter-gatherers, as agriculturalists, as herders. Grounding. We get a lot of incredible elements from the ground, mainly ions, and these or electrons, and these electrons give us energy. They help the mitochondria produce our energy component, which is ATP. Now, if some of the words that I'm saying, you're going, I don't know what she's saying, this all seems confusing, I can guarantee that you will understand everything that I've said and more after you have finished the course, because all I'm giving you is a diet is helping mental health issues. Why isn't every psychiatrist talking about it? But they're not. It's a very small percentage. But if you know that you can help, and you know what's going to happen is that doctors are waking up, psychiatrists are waking up, gastroenterologists are waking up. I could tell you so many wonderful stories about these people waking up. They need health coaches. So if you're a nurse and you're wanting a change in lifestyle and work with these types of doctors, then they're looking for you as long as you have the knowledge that I give. We've got so many people waking up, and we need these people out there. But if you're just here for your family or for yourself, that's fine too. You will still get the same information, but you'll be able to help yourself because we've been taught the wrong information. And it's all coming to light now. Connection is also important with fellow humans, not just, I know we're doing this on Zoom because this is easy to do on Zoom, but yeah, we've also got, we need connection. Nature is so important. And I could go on about nature and what it gives us, the ions it gives us, the minerals it gives us, the spore biotics it gives us, the soil biotics it gives us, but that's for your education. Non-native EMF, so getting out and getting infrared rays, which you get from sunshine. You don't have to go and buy yourself an infrared machine. You can get that in the sun. So there's lots of rays out there that come as a result of getting outside, and lighting. You know, we discuss lighting because that's really important. So let's look at the courses available. So here are the courses available. We have an Introduction to Nutrition course that goes for 12 weeks. Goes for 12 weeks. That's what we say to people, to go for 12 weeks, but it depends on your veracity of how you do this. You know, some people can finish it in 5 weeks. Some people, it takes them a year to get through the Introduction to Nutrition. But I can tell you this, in 12 weeks, you're just learning the groundwork, the basics. You're not learning the deep dive into the science and the deep dive into the vitalism, and we dive into cholesterol and salts and sugar and why they're not bad things. In actual fact, they may have some goodness in them, you know. We deep dive into the immune system and autoimmune diseases and the gastrointestinal tract. But the Introduction to Nutrition is just to pique your interest, or to, if you're not understanding a word I'm saying, that might be a really good place to start. But if you're really understanding what I'm saying and you want to do a deep dive, and then when you have to either help yourself or your family, you know exactly what you're doing, or if you want to get into the public and help your community, then you have all the knowledge that you need in order to help them through either 6-week courses, or helping them clean out their pantries, or helping them change to the ketogenic diet, or to whatever diet that perhaps their GP or their naturopath or someone else has asked them to do, but they need their hand held and they need some help with it. You have that ability to do that. So the next one is the Functional Nutrition Essentials, which is a 12-month program around the 450 hours. And it is exactly the same course as the Functional Nutrition course, but we do it with Q&A as opposed to assessment, and working with a professor or a teacher to help you through the assessment with that IIC accreditation, which you'll see on the 4th line. The next course that we have available is the microbiome course. It's a 12-week assessment course, and that's usually for postgraduates. And it's for people who really want to understand the microbiome course. So let me tell you about IIC accreditation. It's an international accreditation with the International Institute of Complementary Therapies. And you become a functional nutrition consultant, and you can be insured with that. And we have our graduates working with doctors, GPs. We have graduates working with specialists. We have graduates that have gone on to create their own products and are doing incredible things with products that can be done for hormones, food. What else are our graduates doing? We've got them making an array of products and having incredible success with them. We have graduates that go out and just do health coaching, where they help people in their community, especially if you're in a country community where this information isn't well known. This starts to change the community's health. I've seen some incredible changes with people taking on their community and really teaching them in 6-week courses, and then getting down to the nitty-gritty with them. Our graduates are eligible to become GAPS coaches, that's gut and psychology syndrome coaches, or gut and physiology syndrome coaches. That's under the banner of Dr. Natasha Campbell McBride, an incredible doctor that wrote the GAPS program. You can now coach. Once you've graduated, you can become a GAPS coach. You can also become a smart DNA practitioner, where you learn more about the microbiome and you learn more about genetics and how we use food to enhance our genetics and enhance our microbiome and make sure it's working at its best. You can also become sympathetic dominance protocol coaches. So a lot of people are in hyper alert and they're in sympathetic, and sympathetic means that your adrenals, or not your adrenals, but your hormones are screwing up. Your digestive system is not doing well. But what you can do is that you can run fast and you can get out of trouble fast, but you are having trouble with getting into the parasympathetic, which is your rest and digest, and starting to relax and start to digest and get your hormones working again and getting back into fertility. So you, as graduates, can become a sympathetic dominance protocol coach. So who do I think the course is for? And this just goes to who have done this course before and who have been successful with the course. So we have professionals wanting to upskill, so chiropractors, physiotherapists, dietitians, believe it or not, doctors, medical doctors. We've had a lawyer do the course. So those professionals that want to upskill. Second is parents wanting to do the best for their families and themselves. We have a lot of parents that are doing this, especially parents that have kids with neurotypical issues or gastrointestinal problems, and they're not being helped by mainstream conventional medicine. The drugs just aren't working, or medication isn't working. The diagnoses just don't seem correct. So this is parents wanting to take responsibility for themselves and their families. We have lots of PT instructors that really love the course, because what they're learning is dietary guidelines and they're realizing they're not working, and they can really work one-on-one with their clients. Health spa employees, we're now upskilling health spa employees around the world. We are looking at the Maldives, Ireland, London, and the Arab Emirates at the moment, where we're helping upskill health spa employees. Yoga and Pilates teachers, you're wanting to change a career. You don't want to be in the career you're in at the moment. You know you can make a difference in your community. So that also. Nurses, we have lots of nurses that are fatigued by the system. Look at the food that they're being fed in the hospitals. Look at the amount of medications that they're taking. I swim with a nurse and she's retired, and I said, "Do you miss nursing?" She said, "No." She said, "I miss the nursing of old, but I do not miss the nursing of new." She said, "Before they ate, I would give them a bowl of pills." She said, "That wasn't the way to get people well." So I know a lot of nurses that have done the course and are doing the course, and are wanting to work with integrative doctors. Don't worry, even if you haven't been a nurse, you can still work with an integrative doctor after doing the course. We have our graduates do that, and chefs that are really interested in upskilling their nutrition. So there could be more out there, but I haven't thought of it. But there's, actually we had a policeman or policewoman do the course because she wanted to get out of the police force.